us thousands if we ring up. Is it worth ringing up? What sort of money are you talking about?
Sure, okay. For the treatment of sort of hyperhidrosis, which is effectively sweating underarms, and this devastates people. People get very depressed over it. People sort of, don't leave their home for a long period of time. It's 300 per arm, so that's not very much. And may I say that Ireland's one of the few countries now that is still treated cosmetically. The VHI should be covering this, and Bupa should be covering it. Britain, France, Germany, America, all treat it as a medical disorder. And the only alternative treatment is rather radical surgically, removing sort of, the sympathetic ganglion. And we've seen recently some of the horrific consequences that can happen.
Okay, so again, you're not talking about taking out an extra mortgage. You're talking about prices that are within most people's pocket.
Oh, absolutely.
All right. What age would you start treatment there? Because I know some children have a problem with body hair.
Oh, sorry, for the treatment of body hair?
Yeah.
It's very funny that you should ask that, Aidan, because somebody just phoned me up yesterday about a child who was 8, and I sort of have to make a decision. Apparently, we have to work up sort of anybody at that age to see whether it's hormonal, idiopathic, whether it's polycystic, ovarian syndrome on board. Yeah. And if the child has sort of hair at pre-pubertal levels, usually there's a pathological reason. It may be an androgenic tumour. It may be sort of some sort of difficult consequence. So we normally would sort of run a child like that through a test, a blood test, or put them through an endocrinologist or a gynecologist in some cases prior to sort of being treated by a dermatologist.
Okay, excellent stuff. We'll leave it at that. Thanks for dropping in this morning. There's Patrick Treacy there from the Ailesbury Clinic. And Louise, thanks for telling us your story this morning as well.